I'm going to talk a little bit about what is called baby Botox. We're not injecting Botox into babies, but we are injecting Botox into younger individuals. So the question naturally is, should we be doing this? It shouldn't be for someone 50, 60, 70 years old, maybe someone in their 40s, perhaps someone in their 30s. But why are teenagers and 20-year-olds doing Botox? And is that reasonable? Is it ethical? Is it correct? I would say that just doing Botox could be looked as a luxury item where, well, it is a luxury item. Obviously, we don't need Botox to survive. But is it something unnecessary in a teenager or 20-something-year-old? Now, as you know, I do Botox for a whole host of conditions from active acne, acne scarring, texture problems, migraines, TMJ. We're not talking about that. We're talking really, in this case, Botox for wrinkles. So would a teenager have wrinkles? Would a 20-some-year-old have wrinkles? Why would you be doing Botox in someone this young? Is there any merit to it? Of course, there is a short-term gain, which is for a few months, someone looks really good. So if someone's got a big event coming up, Botox does make that person look good, but it typically goes away in a few months. So someone could do it for that, graduation, etc. That may be excessive because most teenagers, 20-year-old or so, look great without needing Botox for any short-term gains. So what I'm really talking about, is there a preventative element? Is there a good benefit to someone doing Botox in the long run if they're on the younger end? So I'll tell you a story. I had a 25-year-old woman who had tons of wrinkles, a lot of sun damage on her face because she used to live in Dubai. And she had a bad habit of lifting her forehead up. So she had the damage of maybe a 45, 50-year-old with a lot of sun damage. It's very fair skin, redhead, and that person, I did Botox every 3 months for about a year, and then I got her now to once every other year. So Botox, if you listen to my other videos, is really powerful cumulatively. If you do it on a consistent basis, you really don't need much over time. And the younger you are, and the younger you start, with the less damage you have, the faster your healing is and the less you need it on the long end. So if you are especially fair-skinned, if you especially have sun damage, or if you have a really bad habit where you're holding your eyes up the whole time or you're frowning all the time, causing premature wrinkling, all I've got to do is break the habit in those cases where you're over lifting and over frowning, so that over time your habit goes away and you're not causing that destruction to the skin. And that can happen pretty quickly after 2 or 3 rounds, and then you really just don't need very much. And the great thing, as I was alluding to, is the younger the patient is, the faster the healing is, for 2 reasons. One is, the younger the patient, the more robust the collagen is, the faster that tissue repairs itself, and the less you need to be consistent with Botox. And the second reason is there's potentially less damage, simply because you're younger. If you wait until you're 75 years old with really advanced wrinkles, not only is your collagen not as robust in terms of the healing, but also your wrinkles may be more advanced. They may take more time to get to the point where you can get to become sloppy, as I say. In other words, you don't need to come in as often. And so there's advantage of starting younger. I don't think it's very common for a teenager to really need Botox as a preventative. The exceptions are more common than the rule, in my opinion. Nowadays, I know a lot of teenagers are getting Botox really just for luxurious items, just to make themselves look a bit better. I'm not necessarily opposed to that. There are perhaps better ways to spend your money. But for me, what I'm passionate about with Botox is really a preventative nature. And so the younger you start, the better. But if you are, let's say, someone not so fair-skinned, you barely have a wrinkle, and you want to start earlier, is it a problem to start earlier? No. I would say, let's say you're a 28-year-old Hispanic person with very early wrinkles. I would probably just say come in once a year, and you may come in twice the first year, then go to once a year thereafter. And if you still hold well, you may come in every other year. So it's sort of like, what I've talked about is, if you are 10 pounds overweight, you don't need to go to the gym that often to get to the point where you are healthy, versus if you're 300 pounds overweight, it's going to take more work to get to the ideal situation where you don't need to go to the gym as often. Same way I look at wrinkles. And so the younger you start, the earlier the problem, the less you need to do it, the easier to maintain it, and long term, you're healthier your skin will look. So hopefully that concept of this baby Botox makes some sense.